Thank you very much to Dr. Hauptman for that comprehensive and insightful talk. I'm going to introduce the first moderator. We have three fantastic panels today that are going to dive into various, the first panel that we're going to get to today will dive into the various approaches that states take in their lead poisoning prevention and responses operations. And so I'm going to introduce panel one's moderator, one of the many fearless leaders at the Rhode Island Attorney General's office. She makes sure that we have everything that we need to do our jobs effectively. She's the Deputy Chief of the Public Protection Bureau in the Civil Division of the Attorney General's office. That is Sarah Rice.
Thank you, Riley. I'm so excited for our panel today that is going to look at different state approaches. The first member of our panel is Terry Howard. Terry is the Deputy Director for the Massachusetts Department of Public Health's Bureau of Climate and Environmental Health. Terry manages 3 of the Bureau's regulatory programs, one of them being the Childhood Lead Poisoning Prevention Project, I would imagine. Joining Ms. Howard is Fred Banks. Mr. Banks began his career with Maryland State Government as a program evaluator in the Office for Children, Youth, and Families, focusing on research and program monitoring related to child wellness indicators. He currently is the program manager for the Lead Poisoning Prevention Program at the Maryland Department of Environment. So welcome to Mr. Banks. Our next panelist is Dr. Siobhan Pappas. Dr. Pappas is the coordinator for the New Jersey Department of Health Childhood Lead Program. She has a PhD in epidemiology and is responsible for the oversight of the Childhood Lead Program throughout the state for childhood elevated blood lead cases. So welcome to Dr. Pappas. And the last member of our panel is Cindy Singleton. Cindy is the Assistant Health Program Administrator for the Division of Environmental Health at Rhode Island's Department of Health. Is the Principal Investigator of the Rhode Island Childhood Lead Poisoning Prevention and Environmental Health Capacity Grants. And so, I'm so excited to get to host this panel. My own work in lead and exposure to lead poisoning prevention programs has spanned many states from the time that I was 5, standing in line to get my fingerprint in kindergarten, to an internship in Maryland where I worked to a sub-grantee for green and healthy homes, to defending actually the Maryland Department of Health for a number of years, and now here in Rhode Island. So I know that we all share in the same goal of preventing childhood lead poisoning, and also that we all have great ideas. So I'm really excited to hear from the panelists today about that. So one question that has come up, I think, here in Rhode Island and probably elsewhere, is what exactly lead safe means. I know that different states sometimes have different levels of certificates, that people have set the lead action level differently. So I would love to hear from the panelists about how they're tackling that issue in their state.
Hi everyone. I kind of chuckled a little bit when I read this question because I've been around probably longer than I care to admit, and I do remember many, many years ago now having a conversation with our general counsel, and I had used the term lead safe, and she was like, do not say that. And I was strictly instructed that I was not to use that term, lead safe, and that I should say like compliant or whatever it was. And so now when we're talking about this, it's a much better way to talk with families, with anyone, about what it is that we mean, because in Massachusetts, anyway, we don't have a lead-free standard. We do have a lead-safe standard, and so it was just much more effective to be able to talk with folks about that, so that people didn't walk away thinking that, you know, I did work in my house and now lead is no longer a problem, and that's just never been the case in Massachusetts. So right now in Massachusetts, we changed our regulations in 2017. We more closely mirror the federal regulations. So lead safe in Massachusetts for a home built before 1978, where there's a child in the age of 6 in residence, needs to be free from lead hazards, and those hazards are movable impacted parts of windows if there's a dangerous level of lead, friction surfaces which have dangerous levels of lead on them, Unlike the federal standard, we don't require that you have to do a dust sample that fails, that then determines it's a friction surface. It's just the function of the surface. So a door jamb, those are friction surfaces, regardless of the dust levels in the home. And then loose paint, and we did, excuse me, we did leave accessible novel surfaces, which are primarily windowsills, handrails, and railing caps. Those are considered lead hazards in Massachusetts. When we do case management, we also address other lead hazards, like if there's lead in soil, if we're concerned about drinking water. But under the lead law, it's focused on lead paint in homes and the hazards that I just listed.
What about in Maryland? Is there a different standard?
There's some similarities. Some of the things that we probably do a little differently is that we include bathroom, kitchen floors, smooth surfaces, waterproof. There's also, I think you mentioned encapsulation of the windows and window sills. There's registration standards for registering your property. There's also change in occupancy and or 2 years to get that property re-inspected. I think one of the most critical things that we talk about is that it's not just a chip and peel and flaking paint, but it's maybe a cause of that. So if there's leaking or anything that's causing the paint to chip and peel, that the property owner has to repair those as well.
So New Jersey, being us, we like to complicate everything. So you know, New Jersey's an interesting place. So we have multi-tier. So our lead safe, which is very new, is based on an inspection, and it's for, so we've had on the books what we call the hotel motel rule, which is actually motels and multiple dwelling rule, and we've had that on forever, which requires any property that is 3 units or above to be on a 5-year inspection for lead. That has been on forever. It's wonderful. Over 90% of our elevated blood lead levels actually come from 1 and 2 family homes. So to fill that gap, we have recently have the lead safe inspection rule and this is for rental properties. 1 and 2 families now have to be inspected. The inspection is based on the percentage of children in the municipality that have an elevated blood lead level. So if it's 3% or higher, the inspection requires dust wipes. If it is below 3%, the inspection is a visual inspection for peeling, chipping, dusting, alligator paint, things like that. So that's lead safe. Now we also have lead hazard free, and so we have lead hazard free, which means everything in the home is fully intact. There is no way that the child should be able to get to that lead hazard. The outside, similar thing, right? If there's no bare soil, anything like that. The water line, the drip line from the house either has nasty bushes that have thorns that a kid isn't going to climb in and lick, or it's covered. We also have lead-free and lead-free interior. Lead-free means everything has been tested. There is no lead in the home to be found and no lead outside to be found. And then there's lead-free interior only, which means as soon as you walk through that door, everything is lead-free, but that porch can have lead on it, the soil, the outside can be lead. So that's us, because we don't do anything easy.
Do you think having multiple tiers is helpful for enforcement?
So I just want to add, in Rhode Island, we do all of the above, and we have 2 different types of inspections. We have the lead hazard mitigation inspection, and we have the CELI inspection, the comprehensive environmental lead inspection. Say that 3 times fast. And the CELI is a surface by surface investigation, testing water, soil, dust, with the dust wipes, and the lead hazard mitigation inspection is more of a visual assessment of the property, the outer buildings, the soil. Recently, we have had changes, exciting changes in Rhode Island with the help of the Attorney General's Office, Child Lead Action Project, lots of advocacy groups where exemptions are no longer exemptions, which is very exciting. So any rental unit in the state of Rhode Island has to have a lead certificate. This is definitely a primary prevention way to avoid childhood lead poisoning. I just want everybody to get their certificate and keep on inspecting every 2 years. And I think we would have a great decrease. I remember attending Green and Healthy Homes Initiative conference, and I was really impressed because I think it was like their lead poisoning rates dropped like 36 to 38% after the first 2 years of them kind of implementing these things.
That's great. And you mentioned the Rhode Island changes. So we just passed the rental registry statute this past year. And I know that that's something that some states have and some states don't. So for example, Maryland has this statute, so maybe we'll start with Maryland. I'm interested from hearing from each of you though, whether you think that's a useful enforcement tool and how you either do use it for enforcement or envision how it might be helpful.
We have rental registry. It's extremely helpful both in funding the program through fees and also through doing compliance checks, audits for fees and penalties to make sure that the majority of our rental registry staff handles our hotline for complaints. They address most of the notices of defect that come in through tenants. They also do tenant evaluations. So they're an integral part of sending those referrals over to our compliance and enforcement and accreditation divisions, which is great for us as on the same floor. So we're all in the same place, and they're literally right next to our surveillance unit as well. So we all work together. But rental registry is a key component for that first entry for a property owner to say, hey, I have to register this property, and these are the things I have to do following the risk reduction standards and getting the certificates. So they sort of manage the process and get it started for us. But as far as funding, we are a regulatory agency, so I would say about a third of our funding comes from registration fees, and they're a key part of their job is collecting those fees and applying those penalties when people are late. So
That's a really interesting aspect that it helps support your other enforcement efforts directly, which I think is very interesting. So have other states thought about a registry and whether it might be helpful?
New Jersey is working on it. It would be very helpful. So we used to have one a long time ago. It was wonderful. And it was actually voluntary. So as a property owner, you could register your rental property as either lead safe or lead free, and you have to provide documentation. And it was wonderful because people could go and look. And also, when you were a nurse case manager, so in New Jersey, if the child has an elevated blood level, nurse case management occurs at the local health department. They are provided with in-home nurse case management and environmental investigation. So if you had a child that needed to be relocated, you could quickly go on that registry and find an alternative for where that child could live, because that's one of their requirements to do. Well, the funding dried up, so that registry dried up. It was very, very sad. But the motel multiple dwelling registry exists. They are working now on doing the registry for the 1 and 2 families. Currently, that resides, New Jersey is a home rule state, which is super annoying. So that means that the municipalities have, the state is the regulatory body and oversees the execution of the regulations by the municipalities or local health departments. Currently, we have 104 local health departments this week. Next week, it can be something different. It literally changes monthly between different agreements. We have 596 municipalities right now. That also becomes fluid. So, but they are responsible for the 1 and 2 families. Some of them already have that registry on their books, and others do not. So we're looking, New Jersey is trying to implement a statewide one where all of the municipalities, because the lead safe rental law falls under the municipality, not the health departments. So what they're looking to do is have all of those local municipalities upload into one central statewide system. But I don't know about other states, but New Jersey, we really like, so people don't like to give up their control. So it can be interesting. But, and also then, I mean, let's face it, right? If there's one central database, then we know who's doing what. And that can also sometimes be, people don't like that. But that's what we're trying, because it's extremely helpful, especially for enforcement. And to know, even just for the, whether it's an illegal, an illegal rental property, if it's not on that registry, that you know, oh, you're illegally renting. And if that person is providing substandard housing illegally, that would be a great enforcement mechanism to say, hey, you can't do that. So, and we do not care in New Jersey about immigration status. That has been our stance. It doesn't matter what your immigration status is, you should be provided with a home that's safe and free of lead and other harmful things. Because we're the United States. How it's supposed to be.
I think that's an important point to make, that we sort of need to do this for all of our communities. What about in Massachusetts? You don't have a registry, so how do you prioritize enforcement?
We do have a
Oh, you
registry.
do?
It's
Okay.
just a little different, so I'm going to tell you about the registry. So in 2003, Boston, Chicago, and one other city, and I cannot remember which one it is, so I apologize if I'm offending anyone, basically got together, and they had this great idea of creating this registry, of sort of putting things online. And that's 2003 anyway, so 21 years ago. And we quickly realized in the state that that was a really amazing tool, and we didn't want to give it up, so we ended up taking it over. So since 2003, we've had what's called the Lead Safe Homes database. It's not a rental registry. It's a requirement for any inspection that's done in Massachusetts that the licensed lead inspector is required to send copies of their cover sheet with demographic data and information about the inspection, the re-inspection, the compliance. They're required to send that to us. And we enter that data into this registry. And so it's been basically online and available since 2003. And this was before, I know I'm showing my age, this is before, when 1 million hits was a lot, we were getting about 1 million hits a year on our website, way before other people were getting that. You know, your kid was getting 1 million hits for doing TikTok. So this was something that was really, really successful as far as an enforcement piece. There's a few things that came out of that I thought was amazing. There was a real switch that happened where suddenly we had owners calling us and saying, why isn't my compliance letter on your website? Whereas before, they would say to inspectors, don't send this to the state, don't let them know about this, we don't want that, it's, sort of don't ask, don't tell, don't shine that light on everything. So we kind of saw that there was a little bit of a move where it was, property owners could see the benefit of actually having their information about their units, compliant units, and having that information available to people. The other thing that happened that was completely unexpected, which was unfortunate, but we were just sort of sharing everything and lessons learned, was we worked really closely with some mobile rental voucher programs, Section 8 programs, and we let them know about this place that they could go to see, is there a compliance letter for the unit that you're going to be renting? And what ended up happening was a gentleman by the name of Howard Wensley, who's since retired. He used to be with the Department of Public Health, and then he went on to work sort of in with mobile rental voucher programs, he knew about this, and so he really started spearheading, letting people know, you should go check this out. And he ended up finding this really unfortunate trend where there were rental property owners that were submitting compliance letters to these agencies that were fake, they were falsified. At the time, this was again, early 2000s, there was a lot, Massachusetts law has been in effect since 1971. There's a lot of work that happened in the 80s and in the 90s. We were not as professional as we are then. We had about 500 lead inspectors. We didn't have specific types of letters that had to be written out a certain way that followed certain rules. So it was a little bit of the Wild West. And so there was a lot of letters out there that, were handwritten, and they wrote in, they just crossed out the unit number 2 and made it unit number 3. And so they were finding out that there was this sort of trend of rental property owners not only deletting their properties, but looking to get financing, federal dollars, to put families into their non-deletted units. So we ended up identifying this real trend, and I worked with the Attorney General's office in Massachusetts, and I was actually involved in 2 grand juries where we basically identified owners that we thought were particularly egregious and actually were, because of their dishonesty, directly related to the exposure of a child, and we were successfully prosecuted some of these property owners. And then, of course, the word gets out there that this is something that people are really paying attention to, and we saw that stopped. So that's like a little enforcement piece that happened to it. More recently, we upgraded our Let's Save Homes database to a 2.0. Time is everything in life, and the timing was not great because the pandemic hit, and then also we were just moving to a new case management surveillance database that includes a document management feature. And so the Let's Save Homes 2.0 allows folks to go in and search their property, and they can actually download a copy of the inspection report and the compliance letter, so that in theory you don't have this thing where it was inspected 10 years ago, but the property's transferred and they didn't transfer the documents and then they're lost. And so it's to sort of get at that issue. So it's amazing, it sounds great, but full disclosure, we still have a Let's Save Homes 1.0, which is everything up to 2019, and then the 2.0, so we kind of inadvertently created this fragmentation of the two, and we're looking to fix that. So we really need to have a 3.0 and bring it all together and have all the old historical data all searchable along with the new data, which has the downloaded documents. So we're working on it. It's not a rental registry. It's for any property that's been inspected in Massachusetts, residential property that's been inspected in Massachusetts. And if it's been complied or re-inspected, that data is in there too.
So sitting in Rhode Island seat, I'm really amazed and shocked, but interested in listening to all the differences. We have one health department, and I can't imagine having others and reorganizing. So yeah, it's interesting how things different state to state, not standardized.
And do you have any thoughts about how Rhode Island might use the new registry to prioritize enforcement?
Oh, certainly. They're going to submit their certificate of lead conformance. So there's accountability there.
Because right now, how does Rhode Island enforce certificates of lead conformance law?
That's a great question. Thank you for asking. So in the past couple of years, I would say 2 years ago, we increased transparency, and we broadcast on our website a dashboard for the public to look up whether or not the property has a certificate. And I think this has really grown awareness about what hazards, picking a safe place. It's an option for tenants to research before they make that choice of which apartment they're going to live in.
Great. I think another question as both the enforcing arm and obviously public health officials that comes up a lot is, how do you handle the case of parents as owners, people that have a vested interest in preventing the lead poisoning and who might be resource constrained? How do you target enforcement or address those kinds of scenarios? And maybe we'll start with New Jersey, come forward again.
Okay, so New Jersey. So there's two things. So if a child has so we have different rules. If the child has an elevated blood load level, they must follow NJAC 851, which is mine. Not mine personally. So if there is lead found in the home, it has to be abated. We do not allow for remediation for an elevated blood load level. It must be abated. They have to use a licensed abatement contractor unless they own the property. They own the property, they can actually do the work themselves. We highly recommend that they take a lead safe work practices class. We can't enforce that, but it must be, but they do have to still do third-party clearance. They can't do the clearance themselves, they must do third party. But also, New Jersey has $180 million that they give out for low income and, I'm gonna say moderate income. I know they say moderate, but it's really not. Low moderate income for abatement and remediation. So even if you don't have an elevated blood load level, which is what we want, we want the work to be done prior, you can apply for this funding, and it's through all 21 counties. So it's accessible through all of New Jersey. And these contractors, it's specifically, different contractors to go out to, and you can apply for it and get that. So $180 million is a lot of money. They also have $200 million for to replace all the lead service lines in New Jersey. So we're throwing a lot of money at it, so that's how we address it. We throw money at the problem so that if they can't afford it, they can actually go through this.
Is Maryland similar?
Yeah, we do owner occupied. The surveillance unit will handle it the same way. We make a recommendation to the local health department for case management. They'll refer it to our compliance and enforcement division, who will do environmental investigation of the property. In extreme cases, they'll do an abatement order. In extreme cases, if they identify neglect, they will refer either back to the local health department to do a child protective services referral, or we make them go ourselves. And we'll work with our assistant attorney general to help us get that. That's our assistant attorney general right there. And can I go back to the previous rental registry thing? Because I was getting dirty looks just from my
Absolutely.
I forgot a couple of things. So we do have they coached me last night, by the way. And am I doing okay so far? All right, so we have an online rental registry database that holds in upwards of 150, 200,000 properties or units. We get downloads from our State Department of Assessment and Taxation monthly to update that platform. We also have a relatively new platform, LRCA, lead registration, certifications, and accreditation. Those two systems talk to each other. So our LRCA software allows for public facing. I can see if I have a lead certificate on this property. It also requires that any contractor, inspector, lead worker, it has an accreditation number. So all these repairs that have to be done, or lead abatement projects, have to be done by an accredited worker and supervisor and lead workers, all of which our accreditation team goes out and monitors the work. So these two systems talk to each other. So if a person registers their property, that NDE tracking number that says this property is registered goes into our LRCA system. That LRCA system then sends back a certificate number. So if there's some inconsistencies, we run an audit, and we might see a property that's registered but didn't have a certificate number, they'll get a letter of advisory from us to say, hey, it looks like you're out of compliance. If you do have a certificate, let us know. If it was done in paper some years ago before the system was in place, they'll usually email a copy of us when we update that. So I just wanted to make sure I got that out before I got out. But yeah.
as you can tell, all of these systems are kind of complicated, but they do end up, you know, in the flow of it, making the job a little bit easier, I think. And I know as like a consumer, someone who rented housing in Baltimore for a long time, it was incredibly helpful and helped me choose where I was going to put my housing dollars. So I appreciated the Maryland Rental Registry. So another topic that comes. Oh
Can I
no,
do-
I'm sorry.
I
Yes,
was
I'm
doing
sorry.
Massachusetts.
I
That's
forgot
okay.
that we were in the middle. So how does Massachusetts handle parents as owners?
Yes. So, I'm looking for Johnny Smith. Johnny used to be a code enforcement inspector for the Child Lead Poison Prevention Program in Massachusetts, so I know he appreciates this because he lived it on a daily basis. So, just to go back, so in Massachusetts, property built before 1978, child under the age of 6 in residence, doesn't matter what the child's blood level is, it doesn't matter what the ownership of that property is, it needs to be free from lead hazards. The enforcement of that happens in two ways, and this is the same conversation I would have with property owners, is either a child is identified as lead poisoned, lead exposed, or you probably own a rental property and someone is exercising their rights to have safe sanitary housing. So that's typically how the enforcement happens. So I'll deal with the first piece, which is the safe sanitary housing. So parents have the right to contact their local health department. We have 351, one of them, I should know that number, I'm getting confused, of them as well. And if they have a licensed code enforcement lead determinator there, then they can request to have a code enforcement lead determination done. So it doesn't matter what the blood level is, and they can go in, they'll do a spot check for lead, they'll issue an order to correct, and they'll require that property be brought into compliance. The other piece is a child is exposed. So again, the statute is primarily preventative. It's not supposed to, you're supposed to be free from lead hazards before a child gets exposed. It's your own home, you rent the home, it doesn't matter what the child's local level is. But not everybody necessarily does what they need to do, and we do identify children who get exposed. So we have a very aggressive process in Massachusetts that I think is one of the reasons why we've been so successful in getting so much of the housing stock leaded. So if a child is identified as lead poisoned, which right now in Massachusetts is defined at venous lead level of 10 micrograms per deciliter, then one of my case management staff, 3 staff, will actually be assigned to the case, clinical care coordinator, community health worker, and a code enforcement lead inspector. That code enforcement lead inspector will go and do an environmental investigation, and then they will issue an order to correct. That order to correct will basically set up timelines, 30, 60, 90, 120 days to meet certain things to get that property deleted. Almost none of our houses get deleted in 120 days, but it sets up those timelines. So the 30-day timeline is if you need to apply for financing, show us that you've applied for financing. But by day 60, there needs to be a contract in place with a lead abatement contractor, or someone has to have the training and certification to do that work in the home. Most people will be able to meet the 30-day deadline. The 60-day deadline is the one that people really struggle with, because anybody who's ever even done renovation work or abatement work, putting together a plan for what you're going to do for your house is very time consuming. You need to be thoughtful about that. It is very common, whether it's a rental property owner or a parent who owns the home, that they'll miss their deadline on day 60. Day 60, if the deadline is missed, our code enforcement lead inspectors will file a complaint in housing court, and we will go to court, and we'll go before the clerk magistrate of probable cause hearing. And we basically, at the time we go to probable cause, we have enough evidence to move that case forward. We know there's a child under the age of 6 in residence. We've established that there's lead violations. Most of our cases, though, we keep in the probable cause hearing before a clerk magistrate to basically say, our goal is not to punish property owners or parent property owners. Our goal is to get this home deleted, but we need to do this in a very sort of specific, measured way where everybody is sort of, coming to the table on a very regular basis to make sure certain milestones are met. So once we get into court, that order that set up the 30, 60, 90, 120, it doesn't go out the window, but basically we get property specific. So at that point, we're before the clerk magistrate, and we deal with whatever the barriers are for that particular situation. Is it, that they have a house in probate that they're trying to work through who's going to pay for this, or there's some very, very complicated situations. Are they back Are they behind on their taxes? And so because they're behind on their taxes, they can't qualify for the Get the Lead Out Loan program. So we sort of work very specifically with that situation before the clerk magistrate to address whatever the issues are and get that home to let it. So very few of our cases get beyond. Almost all of our cases do go to housing court, and almost all of them stay in the probable cause hearing. Occasionally, you'll have a situation where someone just sort of feels like they want to test the waters, if you will, and sort of see just how serious we are, and it may in fact move forward. But typically, by the time you're having a pre-trial hearing, everybody is fully cognizant of the fact that we are going to move forward with this case. And pretty much whatever barriers were there have sort of been resolved, and we're able to get that home to let it. So we have a very, very aggressive stance for code enforcement in Massachusetts. It's been really, really successful. So again, it's whether it's a rental property or whether it's a parent and it's their own home. We actually have recently had the opportunity to look at our data, and it shows that about 50% of our poison children are actually owner-occupied. So it's for parents. So we're spending half of our time dealing with those cases. So that's how we do our code enforcement in Massachusetts.
And what about Rhode Island?
Yeah, I just want to point out that certificate lead-related responsibilities are under the Department of Administration. The Department of Health signed an MOU in 2019, and the program transitioned into Rhode. We migrated 300,000 records in September 2021. The Housing Resource Commission's database was very antiquated. It was just a registry of there being a certificate, but there was no certificate and no inspection reports. The greatest thing about the program coming over is it makes sense to tie in the lead poisoning prevention and the certificates, and it's easier to follow up. It's one comprehensive data system for the whole state. Thank goodness it's just one.
Yes, that's wonderful.
Yeah.
Brilliant.
But it always kills me because people contact me all the time. I need a copy of my certificate. We don't have, they don't exist, that's the thing. So that's why I believe that there's been so many changes, successes, big wins the past, I'd say 2 to 3 years, because we're strengthening enforcement and surveillance with that switch.
That's great, and it leads me to another question. Do you think that the average homeowner or even landlord is aware of their certificate laws? And if you think that they are aware, how have you been successful in educating that population?
Me? Okay. I don't know, I'm gonna start looking at it. I do apologize first, I wanna say I'm not being rude. There is a child in New Jersey in the hospital being chelated right now for lead, so they've been texting me. So I apologize. I'm not trying to be a jerk. So we did a huge public, we went to our landlord associations, our realty associations, and we just went big with them. The health departments, we did our own. And I don't know if anyone saw the news right now, but there is, the EPA was actually doing soil testing at a school. Did you see it? It was great. I was dealing with that Thursday. It was fun. I love my life. So the EPA was doing testing at a school in Trenton, New Jersey, and for legacy pottery, and they have to close all of the athletic fields for high lead. So it made the papers, and it just blew up. So guess who also was told, so they definitely know about their rental inspection laws, because they just threw a ton of information at everyone to try to be like, okay, let's do this, let's do that. Because we do know, so in the city of Trenton, which is our state capital, we thought that our motto should be, Trenton makes, the world takes. Actually, it's actually on a bridge. They thought that was a good motto. I'm like, oh my gosh. But anyway, so Trenton is known for, Trenton has some of the highest lead levels in the state. It was a huge hub for both paint and these potteries. It has extremely old housing, and it has very low socioeconomic status. So it's got the makings for everything bad. We also have, there used to be an airport there, right? So for our avgas, we have 53 airports in New Jersey. So, jet fuel is not leaded, but avgas is. So we have a lot of residual from avgas, plus our old automobiles. Then our apple orchards, right? And, lead arsenate was used as a pesticide for apples in New Jersey. So we have everything, and Trenton is one of the hubs of that. The only one worse is probably Newark, because that also has, a lot of bridges and stuff like that, and it's bigger and poorer. But so we just keep trying every single avenue that we can. We just try to blast out the information. Sometimes it's successful and sometimes it's not. If the municipality doesn't want the people to know, it's kind of, we try to go, how many renters, how many property owners actually use a realty company is really the question, right? My rental properties I use a realty company for, so I don't have to deal with anything. I love that. But not everyone's going to do that. So that's one of the issues too. There are avenues which you can get it out, and it can be difficult.
I can go next. All right, so a couple things. One, typically during lead week, our division chiefs get together and they'll do a forum for contractors, lead workers, professionals in the field. We'll also do like a parent forum in conjunction with GHHI, as a matter of fact, and Maryland Department of Health. But as part of our operations, that SDAT download we get monthly, we'll do an annual advisory letter for all those properties that aren't registered. And usually we'll ask for a special report that when you're SDAT, it basically will tell you this person is not the primary resident of this property and they didn't get the tax credit associated with, I think it's a Homestead Act or something. And so we'll generate that list to kind of narrow it down. And we'll send out an advisory letter basically saying, hey, looks like you're renting this property. These are the things that you need to do. And so we usually follow up like twice a year with them. It's a hefty, paper-driven kind of way to go about it. It usually generates a significant amount of calls where parents have handed down the property to a child. They have no idea that this was what they had to do, or property has changed ownership and they weren't aware of, the new owner wasn't aware, or made aware. So it's different cases, but it's a ongoing process. I think we're probably just in looking at the way we interact with the public as far as non-worker public, we're probably at 40% that people are aware of it. I think there's a good number of people that aren't aware that this is what we're supposed to do. But I think on the other side, as far as the professionals that are in the field, they have to know that they have to be accredited. We work with them constantly. We have a list of contractors, lead workers, inspectors that know that they have to follow these processes. And so I think we're extremely high on that, and probably 85-90%. Some of them, which I think one of the panel's members mentioned that some of these lead abatement workers or contractors specifically are bad actors. And we know that they know that they're doing wrong. They're creating a massive amount of invalid lead certificates, but we've been really successful working for our AG's office and going after some of the big fish. And like one of the panel members said, most of these people know each other. And so once you get one of the bigger ones really good, the word starts getting out. And so we get a lot of calls, which is encouraging, from new inspectors and new people in the field to say, hey, I don't want to get on you guys' bad side. What do I need to do? So, you don't want to be a bully, but you definitely want to have a reputation for doing what you say you want to do and following through, because then I think the public will start getting more used to doing the right thing. So, but it's a different challenge every day because there's some creative people who find different ways to kind of get around the laws. You know, we're always dealing with these gaps and what we can and what we can't regulate. It's just a constant conversation of how we can make sure people are safe. So.
I want to quickly ask, what kind of outreach do you think is the most successful for messaging? We've experimented with billboards, radio ads, public service announcements, so I'm just wondering from your opinion and your success, what would you recommend?
Do you have, and I apologize for my ignorance, individual construction, so we have like individual construction officials in each municipality that people go in for any kind of, if they need to do a variance or anything like that. Do you have that?
Not that I'm aware of.
Okay. That's been the best, when they put up a giant thing that says, hey, if you're renting your property, guess what? You have to do this also.
Oh, that's very helpful. So the Attorney General's office has gathered the municipalities and given them some, to give them some guidance. But that's a really great point about when people are walking in, because I know that's how it works in my town. You literally walk into an office. So.
Yes. And also the major building suppliers, your Home Depots, your Lowe's. Hey, you should have your house checked for lead.
So you're suggesting postal signage? Okay.
People don't even know about lead. It's amazing. I don't understand. But especially, this is our world, right? So this is all we do all day, and I'm amazed. And even physicians, I go in, and they're like, oh no, my demographic doesn't have lead. I'm like, you live in New Jersey. Everybody has lead. Everybody. And my children's pediatrician, they're like, no. And then also, on top of that, so they're a great resource also. We did meet with the pediatricians. But also, in New Jersey, 40% go to family practitioners and nurse practitioners. So we tend to target the pediatricians, but we don't necessarily target them, and they're very important.
I would just say, if you can find a way, and I don't know what it is, so the building permit example, I love examples like that where you're tapping into existing systems to do your bidding, to get your message out. So in Massachusetts, one of my favorite examples is before you enter daycare, you have to show proof of screening. So it really helps for making sure that we get the word out about screening, but there's loads of other. So looking for whatever that is to get that message. And one of the things I want to do and I haven't done yet, because I talked about our Let's Say Phones 1.0 and 2.0, is I want to update in 1988, Massachusetts had a property transfer notification before there was any federal requirements. So we've been around for a long time. So there's the property transfer and the tenant notification requirements. The document is still like 12 pages too long. This is the day and age of electronic documents. Like, we are killing trees, bad for the world, bad, no one reads it. What I want to do is I want to update that document, make it much shorter, but then include the registry. So before you can sell this property, before you can rent this property, check off that you checked the registry to find out if it's in compliance with the lead law. So that would be that way of leveraging the system. They have to do that with these other rules, these other regulations, but then you're getting the word out there. Yes, so that's one of my projects for the next year. So looking for that I love the building permit idea. I think that's a great.
And home inspectors.
Yep.
Before you sell your property, a lot of people will get a home inspector. Letting the home inspectors know, hey, why don't you push for a lead test, is another great.
We license lead inspectors in Rhode Island, and they are great support. Yeah, we do.
Yeah, we do too. It is awesome.
System.
It's important. Otherwise, it is the Wild West.
I mean, just wanted to add about, as far as sort of educating property owners in Massachusetts, it is actually one of the things I probably miss in something that I don't get to do. It's one of the things I was hired for back in the 90s that I love doing. And for me, in Massachusetts, it's not so much that owners don't know, rental properties don't know that there is a requirement. They do know that. It's all the misinformation that goes along with that. It's, it's going to be $1 million, or that someone's going to knock on the door, or, it's because they're putting paint chips in the peanut butter sandwich that the baby's eating. There's just so much noise that goes around with that, and I always loved actually being able to do the outreach it's great to work with parents, I don't, but doing actually, the hard audience is the rental property owners and having the conversations with them and giving them the sort of, that balance, like, we're here because you're running a business, and also always tying in, like, hopefully nobody in this room or anywhere in any room wants to basically be responsible for permanently damaging the brain of a baby. And so starting your conversations with that and then saying, okay, now how can we help you help yourself, protect the kids that are living in your properties and protect yourself and your own investment. And then looking for the balance, like there's a $3,000 tax credit you can get. There's this loan program you can tap into. We can get you this training so that we can reduce the cost of deletting. You can encapsulate your windowsills. You can do this. So looking for ways to make it sort of so that they can afford it. And having the sort of the practical conversations, it's that knowledge. Once you, and I've never had anybody sort of walk out of those meetings and not sort of appreciate, you know, yes, now I get, like, I do need to do this and it feels much more manageable. It feels like they can get their arms around the problem. So it's more the misinformation around what it means to bring a home into compliance or get rid of lead hazards that I think is the critical piece.
Those are all really valuable insights and some specific action items that I think people can think about whether they might work in their own state. So I really thank you all for that. One other question that I have is, in your experience, do you find that the more problematic issue is just the aging of existing housing stock, or are you seeing problems with renovations that are not being completed in a lead-safe manner? We can start with Rhode Island. Let's change it up.
All right, state the question again, I'm sorry.
So I was wondering if you had a sense of whether bad renovation practices or just normal aging and deterioration of housing stock
Definitely
lead to
normal ages, yeah, of lead-based paint. We have such old housing stock, it's really a problem to keep up the property.
For us, it depends on the demographic. So our properties in Colts Neck, New Jersey, which is, that's where Springsteen lives, and his kid's on the fire department. But it's extremely affluent, old horse farms, right? So it's old horse money, which tells about the demographic. And so no one, but there's also actually Laird's Applejack is there too, right? So that's where the apple orchards are and were. And so people go and don't, well, I have all this money, so I don't think anything about it. And so when those renovations occur, if the family didn't move out fully, they were having a small renovation, normally they move out. But if there's a small renovation, that's where it happens. Or in Westfield, New Jersey, where it's not as much money as Colts Neck, but it's still affluent, they'll tend to stay in it. So it really does depend on the demographic. Most of the time, it's just the breakdown of the old housing stock. That's predominantly it, but when you get into the higher demographics, it's that no one actually thinks about it at a different age group, a different demographic.
So for us, it's extremely clear to me. I'm still relatively new to the program, but one of the things I was I walked into a huge case we were working on, and it was clear that there were a lot of projects going on that were completed by that people that weren't accredited, whether it's property owners trying to save money or people in the field deceiving property owners saying, yeah, I have my accreditation, and they're not really well versed to know how to check, and so they do bad work. And when I say bad work, they obliterate lead all over the community sometimes, and it's just finding out about it. Unfortunately, I would say the majority of the way we find out about it is the child is positive for lead, and then we find out that this is more of a work practice issue than it was a child having pipe or something like that. It could have easily been avoided if you had hired the right person. So I think that's the hugest issue for us in reference to what you're speaking of. There are a considerable amount of old homes in Maryland, specifically Baltimore City, and there's some, but there's a very amount of sources of how children are impacted. It's in Baltimore City, it's primarily lead paint. But once you get outside the city, it could be spices, it could be celebratory powders, it could be ammunition, it could be soil, it could be, you guys heard about Wanabana, cinnamon applesauce, so it's all over the place. And so we're, the good thing is we have a really, really, really creative partnership with our Department of Health and the locals, and just the way we identify these sources. But so I'm not really concerned about the conditions at home, because we've seen examples of accredited lead workers do great work to restore these homes. There's huge communities that have restored them in a very professional, practical way to make it lead safe. It's not supposed to say lead safe, but yeah, I think definitely unqualified workers is one of the biggest problems.
It's really amazing where lead sources are. I mean, we had a dust wipe a cat once. The cat was happening, and true story, they dust wiped the cat. And the cat, baby couldn't move.
I don't think there's like a standard for.
No, it was amazing. Just wipe the cat. The lead inspector was on the phone with me going, I'm sorry, did you just tell me to dust wipe a cat? I was like, yep, dust wipe the cat. The only thing that baby touches is that cat, dust wipe the cat. And the cat was hopping on a windowsill. And then coming down, and babies with their, open mouth kisses that they love. They're so yucky. We make them cute so we don't leave them in the bush. But they're yucky. So, and that was the baby doing, open mouth kissing the cat, and that's how the lead. So it's amazing how these things, it's usually, it's zebras and horses when we're hearing of these with lead.
So my answer was going to say yes to both of those. Like it absolutely is both of those things. The difference from me would be one of the hazards of actually doing this for so long is you kind of get used to saying the same thing over and over again, and it's just like it's gospel, right? So for years and years and years, Massachusetts has talked about we have a publishing annual report. We list high-risk communities. Exactly like what we've all sort of been talking about today. Dr. Copeland showed up on the screen, the environmental justice communities that just have everything thrown at them. They're just dealing with everything. Poor housing stock, poor people, English as a second language, all of that. So we've talked about the high-risk communities forever, and 57% of our caseload remains. They come out of the 17 high-risk communities in Massachusetts. And so we've talked about that. It's a critical health equity issue, why we need to make sure that we're improving our housing stock. But what I sort of knew anecdotally, and staff had been talking to me about, but up until recently, we couldn't sort of show with numbers that really blew my mind and gets to that part of the sort of generational housing stock that is owner-occupied, that people can't afford to maintain anymore. So it's not necessarily unsafe renovation, but it's housing stock that's falling apart. So our EPIs that we worked with, and I had to pull this out because I'm not used to saying this data piece is, so in Massachusetts for 2022, children living in the most rural areas of the state are experiencing double the prevalence rate compared to other kids. So they're twice as more likely to get exposed. So you're not talking about rental properties, you're talking about generational family housing that's basically falling apart. They don't have the money to keep their house in good repair, and they're getting exposed. So that was sort of an aha moment for me, where it's like, yes, still, I'm not taking anything away from our high-risk communities. 57% of our poison child cases is there, and yet we have this other real risk happening at the exact same time. It's like you feel like you're schizophrenic when you read our data points. You're like, well, which is it? Where's the problem? And you're like, yeah, it's everything. That's exactly it. And then when you do add in, and in that sort of really sort of wealthy community where they're doing renovation work, or maybe they're not doing renovation work, but they live in this gorgeous older historical home, and it's just a gorgeous.
Your dad was making bullets in the garage.
Right, a computer or whatever. You add those cases in, and there'll be a few of those cases every year where you have a significantly exposed child in a very, very, very wealthy community, and those cases tend to be the most resource intensive because they tend to get a bit they can be acrimonious. Those are people who don't really, they're able to advocate for themselves and they really want to sort of take control of their own situation. But as I mentioned, we have a very strong code enforcement in Massachusetts. And so once, before your child is exposed, the law applies, you have every opportunity in the world to bring your home into compliance. Once your child reaches a certain level, you'll be doing it with our help. And with our oversight, and so those types of cases can be very resource intensive and frequently go to Dr. Hopeman to sort of work through what it is that we're trying to accomplish with those families. So everything.
What about Rhode Island's experience?
So in Rhode Island, a child with lead poisoning mostly comes from lead-based paint. Although we have been seeing a trend studying consumer products, spices, turmeric, coriander, a spike in cases where the houses are 2002 and you scratch your head and say, where is this exposure coming from? Maybe it's from grandma's house. So our investigations are very thorough and we do think about all these different things and aspects. We've had an influx of Afghanistan refugees. And there's just projects that we're really not familiar with that they bring over from their other country. The latest one with a very high lead level was, it's not really called sunscreen, but they put it on the child's face and it's full of lead.
These can all be very challenging, and of course there's cultural dynamics in all income brackets and communities that can be difficult to deal with, so I appreciate sharing those experiences too. I know Mr. Banks talked a little bit about fraudulent or non-compliant contractors, and that can be actually really difficult to identify unless you do see a poisoning. So how do the different departments find out about people that might be either misrepresenting that they have a lead safe or certificate or certification to do the lead renovation work, or that they might have the certificate but they're not doing a very good job? How do we identify those cases?
So in Rhode Island, we actually have people that are out in the neighborhoods. We take calls and complaints, and our industrial hygienists go out and visit, see if they do have a license. Is that plastic down? Are they practicing lead safe work practices? So we do them randomly when construction is happening, and they file a start work notice 7 days before the construction. So that's how we usually find out, when things are going bad.
What about Massachusetts?
In Massachusetts, so the Department of Public Health is responsible for licensing the lead inspectors in Massachusetts, but we partner with the Department of Labor, who license the abatement contractors and the renovation repair contractors. So they're the agency that's responsible for sort of the licensing and the monitoring, but we do work together. So if we come across a situation, typically in our instances, it's because someone's been exposed, which is why we're involved. But we also hear from private lead inspectors if they're concerned if something is going wrong. We also take complaints. So if we get a call from an owner, someone who's really worried, neighbors, if you have, certainly in the warmer weather, someone who's not following the rules and they're creating fugitive dust. I actually love that expression. I don't know why it makes me laugh. I just look at the movie The Fugitive, So they're creating fugitive dust and then, people are complaining because it's blowing into their yard, as they should. So we sort of, it could be someone from the Department of Public Health, someone from the Department of Labor, and also our local health departments under the Public Health and Nuisance Statute could go and shut down unsafe work as well.
So there's a couple things we do. So the first, we look at inspectors that are accredited within the first 90 days. We just try to go out and visit them to see if they have any questions, things like that. Also, any projects, whether it's listed as a lead project or a lead abatement project, which is work projects in general, where lead might be exposed, should be notified. They should be notifying us through our LRCA database. How much time do they have to do this? How much lead time do they have to give us? So before the project starts. As a part of that, in identifying potential bad actors, again, our chief of accreditation oversight, he runs a report to see, basically look at how many certificates are generated by lead inspectors. And so if it looks like it's a high amount and it's a little unfeasible that they can do that many inspections, when inspectors have to go into our website to create the lead certificates and put the inspection in, so there's a lot of documentation attached to that. So he's looking for markers to say, hey, this might not be a credible inspection. So there are our accreditation oversight are lead detectives. So they actually look at data to kind of see what doesn't look right, to identify somebody that might be creating invalid certificates, and go out and monitor work sites and inspections to make sure things are in order. So unfortunately, we've had some situations where we had other government offices that have had some bad actors, if you will, and just kind of skip some steps. So it's not just the private sector. Sometimes it's our cousins in the backyard that are local and state governments doing things. So we spend a lot of time trying to figure out how we can sit down with them and say, hey, if you did this by accident, we won't do it anymore, but this is what you should do in the future. But we have been really fortunate since 2001 to have that LRCA database, because it makes identifying bad actors so much faster. And it's, we actually give them, like I said, run a report to say, hey, this doesn't look right, and go right after them.
That's great. What about New Jersey?
So we are required, so any abatement lead abatement occurs in New Jersey, you have to use a licensed lead abatement contractor. That the lead abatement contractors are publicly available on our, as we call Big DCA, Department of Community Affairs website. They license them. Also, whoever does the third-party clearance that is required for all lead abatement work, they're also licensed through DCA, and they're on the website. They must, any lead abatement that occurs needs to tell DCA 10 days in advance, and they actually send someone out to check on the work. If there's a child with an elevated blood level, they also get checked out by the local lead inspector risk assessor in that local health department. They follow the work, they follow the third-party clearance. If they think that anything is not on the up and up, they flag it and they send it to DCA and to me. And then DCA and I work together to identify.
Those are all great tips, and it does sound like it just takes a lot of both process to register everybody and monitor, and then legwork to get everybody out there and checking out that work.
Can I interrupt 1 second?
Yeah.
I just want to say I love the data example, because in the examples that I was talking about with when we found the falsified compliance documents, but also when you're looking at patterns with inspectors and certain abatement contractors, and when you see like every single job that they do is together when that's not really
Yes.
supposed to happen. It is critical, like having that data set and having someone look at that data set is really important. And for years, we were doing the legwork piece that you were just talking about, right? And complaint-based and following up, and that's also very important. But it wasn't until we were able to sort of really look at our data and quickly run reports and sort of identify trends that we suddenly became much more efficient and effective. So I think that, when folks are thinking about what they want to do and how they're like, data is everything.
Data is everything.
Yeah.
Just one more thing to add. So one of the great things we were able to do is, once again, working with our AAG, was that if we identified a bad actor, we could suspend them, put a notice of suspension so they couldn't create any additional certificates. We had sometimes inspectors create like 500 bad certificates in a short amount of time. So we were able to work with the AAG's office to say, hey, let's suspend them. They can't create anymore, so it kind of lessens the bleeding. One of the unfortunate things is a lot of property owners were unaware. We have to tell them, hey, you have to get this property re-inspected. So it's sort of the bad part of it. I'm not real sure how many of them knew that they were using an inspector that wasn't doing what they're supposed to, but I really kind of felt for them, because it's, they're kind of, out of whatever the cost was for the inspection. They have to go after the inspector for it. But it is one of those things where you have to kind of explain to the public, once again, going back to outreach, say, hey, here's our list of accredited inspectors in the future. Go by this list. Don't go by, just people that you meet kind of off in the darkness. But yeah.
I think we're coming up on time, but I think we have enough time for each person. It would be great if you had maybe a practice from your state that you found very efficient or helpful that you would want to share with your sister states here or out there who are not on this panel. Do you want to start with Rhode Island?
Sure. So, I'm going to get nervous because I've already forgot the question. What was the question again?
Do you have a practice in your state that you have found particularly effective or efficient that you would want to share with others to adopt?
So I don't know the certificate situation in other states, but truly the certificates of like conformance, all the different types of certificates, is a way to truly hold the homeowners, landlords accountable. It's, again, been very interesting to hear all these different stories, and I've already got some great ideas to follow up on and maybe implement, so.
That's great. What about Massachusetts?
So I already sort of alluded to one of my important or shining examples is looking for ways to partner with other people and leverage whatever that work they're doing and inserting your goals into that, and vice versa, you can do that for them too. So I gave the example of we partnered with early education and childcare, and they wrote into their licensing regulations that childcare need to check to make sure that children have been screened. So they're basically helping us with our screening penetration. Anything like that. So if you're working with the building department and making sure the building department is letting people, if they're renovating local property, that they should be doing it using an abatement contract or whatever the requirements are. So I definitely feel like you have to look around, and we're doing it right now. We're in the room together. See who your partners can be. See what you can leverage. See what you can do for them. See what they can do for you, and work with your Attorney General's office to do. I strongly believe in really strong code enforcement. I really like having that sort of as our foundation, and then making sure you've got the strong code enforcement that they know is going to be clear, consistent, and is going to happen. I think you actually alluded to this, knowing that that's there, and then giving them the balance and the tools. So whether it's financing a tax credit, training to do the work, but knowing that that code enforcement is there is critical. And last but not least, I already said this, with that data and getting stuff public facing, the legislative registries, whether it's a rental registry or whether, I just think is really figuring out how to get that into existing systems like property transfers, I think will make the sort of the bigger difference.
So for that question is great, but I think one of the first things that we talk about with our staff is, we talk to the public a lot every day, and one of the questions we get is, what gives you the right to do what you do? So for us, it's the law, it's the policies have been extremely helpful. You can see in Maryland, there's a popular graph that we show in our annual report that since the policy change for Maryland's law, our elevated blood lead levels have dropped 98%. And so we're at 3.5 blood lead reference level now. Our surveillance team has been sending out notifications to the parents and the property owners since October of 22, I believe. Our compliance enforcement team just started going out to do EIs in January this year. But just being able to have the law kind of support what we do has been huge, and basically, not just notifying parents and family members and property owners of what their responsibilities are, what's going on in their homes, but also in kind of keeping contractors and lead workers kind of in check. So I think the policy is key to kind of moving the needle as far as outcomes.
I was gonna go with the stick also. Right, we have the carrot and stick.
That's right.
Yep.
And we have a lot of things on the books that are unenforceable, right? Because there's no stick. And I know it sounds awful, but I think you need both. I think you need incentives, and then you need a way to enforce it. Because if you don't, it's not, I think the shift in, by the way, I always operate one step away from being fired. So, it's just who I am. But I'm going to say this, in American culture, we shifted from a community-based culture to an individual culture, right? So if I'm looking out of I'm not going to do something for the community good. I'm going to do it for what's best for me. It's just a shift of our culture, and that's the cultural shifts occur all the time. So without the stick, though, right, then no one's going to do it. So I think that is something that is extremely helpful. So you need to have the data so that you can enforce with the stick. And I think
I just want to thank all of you for your time and insights. This has been just so helpful, and I know that for everyone listening and for me and my team, that we have great ideas to take back. So thank you all.